Hi, my name is Dr. Rudra Mohan, and through the Oral Health channel, today we're going to be talking about the Damon philosophy of passive self-ligating bracket systems. Let's start. So I've already made an episode on self-ligating braces and brackets. I'm going to be talking about something known as Damon because I got a query from one of my viewers about the commercials about Damon and how it is better than most of the other ones and why is it so famous. So I went back to the books and I went through the literature, obviously because it is the episode is short in issued in the public interest. I will not go into the science of it, but I will still tell you why the Damon philosophy works and it is better than the rest of the other brackets that are present in the market, and compared to conventional brackets. Why is it better? Because of the fact that it is a passive self-ligating bracket system. That means you don't have to use ligature wires, you don't use elastomerics, and that's why the bonding on the tooth directly helps in better tooth movement, faster tooth movement, more effective tooth movement. And why does it happen? Because of the decreased static and dynamic frictional resistance that is usually encountered with the conventional bracket systems. Now, for a patient's outlook, you need to understand that a treatment time in an orthodontic treatment is absolutely of importance when it comes to the treatment completion, the treatment duration, and the number of appointments and how frequently that they are spaced. When it comes to people who are young people who are going to universities outside from where they live, it's also a possibility that you might want to get lesser appointments. That's where the Damon philosophy and self-ligating brackets, they come in better because the inter-appointment interval time is lesser. The initial time where the tooth movement is happening is much faster than the conventional brackets as per the literature, and because of the lesser frictional resistance, the resistance towards tooth movement is lesser, thereby decreasing the pain or the discomfort that is felt by patients. Also, if you're going out for a longer time and the appointment interval is not is supposed to be very long, it's not a problem. You can handle it because most of the initial tooth movement can happen much faster than conventional brackets. When it comes to the design keeps on evolving, and the brackets are smaller and they bear less stress to the other oral structures such as the gums and the the bone and all those things, and that is why it's a very compact bracket that has a slot and a gate in it which houses the arch wire which is causing the tooth movement. It has also been shown that in borderline extraction versus non-extraction dilemma cases, you can go for these brackets and thereby reduce the possibility of getting the extractions done of your teeth for orthodontic purpose. So that's one advantage if people are very sensitive about the fact that they don't want their teeth to be extracted for orthodontic purposes. In borderline cases, it has been found that they have been much better and you can save the teeth by retaining them in the arch, because they also cause they have been known to cause arch expansion also, and they do not require any sort of auxiliaries or other gadgets or appliances to be placed to expand the arch, such as rapid maxillary expansion and quad helices. So all in all, the Damon philosophy works very well in terms of reducing the chairside time, the duration of the total appointments, as well as the patient discomfort as per literature. Although the manufacturing is somewhat more expensive than the conventional brackets, and thereby you might feel that they are slightly economically on the higher side. But then again, if you are interested in better treatment and if you can afford that treatment, I would suggest that it's not a bad way to go about getting your orthodontic treatment done. So this was today's episode. Please like, share, subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles. Kindly refrain from calling me directly as I might be busy with patients, or otherwise just drop me a message on WhatsApp with your name, your location, and the common health problem that's causing you discomfort, the oral health problem that's causing you discomfort, and then we'll have a talk. If you have any queries, doubts, apprehensions, or insights or suggestions, please feel free to put them in the YouTube comment section. So that's it for today. Thank you.